If a lift hurts, people do one of two things. They either stop training or they push through it and hope it goes away. Both usually fail. Today, I'm going to give you a simple framework to rehab any lift: squat, deadlift, press, even Olympic lifts, without guessing, babying it, or restarting every few weeks. This isn't just some copy-pasted program or a random list of exercises. This is going to teach you how to think about rehab so that you can apply it to any lift you care about. Before we talk about the framework, you need to understand one idea. Pain usually isn't about the lift itself being bad. It's about the load you're asking your body to tolerate exceeding its current capacity. If your training load is right at your training capacity or just below, your body can adapt and get stronger. But if that training load exceeds capacity for too long or too often, that's when symptoms start to show up. It doesn't mean you're broken or you need to change everything. It just means the demand you put on your body outpaced what it was ready for. So then rehab isn't about avoiding load. It's managing load in a way that allows your body to adapt and recover instead of breaking down. And that's what today's video is all about. You have a lot more control over your training load than you realize. And once you understand that, that allows rehab to make a lot more sense. So the framework. Every lift can be divided into 4 things that you can control: the range of motion, the load, the tempo, and the frequency or volume. So when pain or symptoms show up, we need to figure out which one of those 4 things need to change to allow you to keep training. We don't just throw away the lift in its entirety. Typically, the first thing I'll try to address is range of motion. This is because in most cases, people will have pain in a specific range of motion, not the entire lift. For a squat, that could mean having pain in the knees or the lower back at the very bottom, but at no other point during the lift. And same goes with pressing or any other movement. You can have pain at a specific point, but not anywhere else while you're doing that lift. When you're having an acute flare-up, this is one of the quickest, highest value things that you can change. Just modify the lift to work around that painful range of motion instead of pushing through it. Some quick examples, let's say with the squat. If you have pain only at the bottom of the squat, while you're working to rehab this injury or this flare-up, you can temporarily switch to box squats, or you're squatting to the box above where that painful range of motion is, or modifying to partial squats or pause squats above that painful range of motion to get the same stimulus. The same can be done with a deadlift by temporarily switching to rack pulls, or with pressing by modifying to a floor press, a block press, or similar variations. I don't count this as a regression or cheating the lift. Being able to continue training at a very high load without taking away the exercise completely is a great tool to have in your toolbox. This option is great for keeping training intensities as high as you can while you're working through or around an injury. Now, the second thing I'll look at is load or intensity of the lift. If you notice that you're only seeing your symptoms once you get to a certain intensity or percentage of a lift, this is for you. No, you don't need to strip all the weights off the bar and go super light or easy for a couple weeks. While yes, that might help, the goal here, remember, is to keep your capacity as high as possible while you're rehabbing and recovering. So let's just use an easy example here. Let's say every time you get to 90% of your 1 rep max, you experience pain. With whatever lift you're dealing with, whether that's a squat, you feel knee pain above 90%, or a bench, you're feeling that shoulder pain. What can you do? First option is just to increase the volume under 90%. So all of your working sets should be under 90%, but you can do more sets or more reps in that 80, 85% range, even 75% range, and still get a really good stimulus without going over that threshold and without flaring up that pain. Now, this type of flare-up is not super common, but you'll typically see it in really high-performance individuals. So if you are very strong for your lifts or even for running, sprinting, when you're operating at a very, very high intensity and very high performance, that makes you more likely to experience these aches and pains and these twinges at those high intensities. So besides just increasing the volume below that aggravating intensity, there's another thing you can do, which kind of leads us into the next point, which is the speed and the tempo. Altering speed of any lift will drastically change how it feels. Adding slow, heavy eccentrics to your program will allow you to train at just slightly lighter weights than you normally do, but still get that same training stimulus. Another big advantage to using tempo work, which includes pauses as well, is that it's going to really reinforce your positioning. This is especially helpful if you're newer to a certain lift, certain movement. Adding in some slow tempo work is going to challenge your positioning, which should in theory, help to clean up any positional or form issues that are exacerbating the issue at hand. Now, in this bucket of modifications is where I'm a big fan of adding in a lot of isometric work. So if you notice that a certain portion of a lift is a big struggle for you, this is where adding in some either yielding isometrics where you're holding at that joint angle for a prolonged period of time, or doing overcoming isometrics where you're pushing hard into an immovable object at that specific joint angle, both can have great carryover to the lift that you're trying to improve on and trying to get rid of that pain in that position. Now, most pain or flare-ups don't come from just one bad rep. They come from accumulating or doing something too much, too often. This brings back that load and capacity relationship. No matter how great your form is, or you're doing the perfect ratio of pushing to pulling, if you're doing too much, too hard, or too often, your body's just not going to be able to recover and you're going to be in for a bad time. So good rehab doesn't mean just throwing away all these lifts and putting together all these weird positions and postures. Good rehab is sometimes about just exposing yourself to a little bit less volume. That can mean lowering the sets that you're doing in a workout. That can mean lowering your weekly frequency, so doing 4 sessions instead of 5. This is also a really good opportunity to look at your accessories. If you're really struggling with shoulder pain during pressing, for example, and you're not only doing heavy bench, but you're doing heavy dumbbell bench, and you're doing machine chest press, and you're doing push-ups, you're doing a ton of pressing, if you want bench press to be the main thing, make that the priority, maybe cut out some extra sets of your accessory work. The inverse can be true as well. If you're looking at the bench and saying, you know what, this is not super important to me right now, cut the bench, accumulate volume elsewhere. The key there is remembering that all sets, all reps of everything, all accumulate on your body, whether it's a very specific movement or more of a general movement. You need to look at everything and seeing what kind of demands you're placing on your body and where you can pick and choose what you need to remove and what you need to keep depending on your goals at the time. Okay, so let's say you've gone through everything. You've tried changing the range of motion. You've tried reducing the load, maybe adding some slow tempos or some pauses, and you've reduced your volume, but you're still having pain. What do you do next? That's something where you can look at, maybe we change the exercise entirely. So for example, if you're really struggling with your squats and you're feeling a lot of pain with that squat, let's look at how can we change the way that it's loaded. So instead of doing a back squat, we might switch to a front squat for a period, or even a goblet squat if we need to. Or we can change the motion entirely and go to a more single leg dominant version like a split squat. Now, how we make those decisions is where we look at the spectrums of movement. Looking at a squat, for example, you have squats that are more hingy and squats that are more squatty. What I mean by that is a squatty position is going to be much more vertical. You're going to have a lot more bend in the knees, a lot more hip flexion, just a lot deeper position. Whereas a more hingy squat is going to have a little bit of that bend at the torso. The hips are going to be shooting back. It's going to almost look pretty similar to a deadlift type position. So if you're struggling more with back pain, hip pain during your squat, you might want to shift towards a more squatty position that avoids that hinge in the hip that might be irritating. But if you're struggling with knee pain in the squat from those deep knee bends, maybe we want to temporarily switch you to a more hingy type of position to get less knee bend, but still allow you to load the squat. Now, what's important there is we still want to make sure we're getting some stimulus to that aggravating motion, but just less. So again, looking at that example, if you were to be doing a squat, you get knee pain at the bottom. So right now we're going to shift you towards a more hingy squat or even just a box squat to avoid that painful range of motion with those heavier loads. Meanwhile, we're going to find an exercise that challenges that deep knee flexion without being as irritating. That could be a light heels elevated goblet squat. That could be doing a split squat with the front foot elevated, so we're getting more knee flexion there. Something to challenge it without irritating it and allowing you to build up capacity while still staying strong. Now, before we wrap up here, I want to give you the full picture of rehab. This checklist of what you can modify is mostly focused on activity modification because that's the first priority. Keeping you training hard and lifting safely is the top priority because that allows time to be on your side. It allows you to be able to recover. It allows you to be able to your body to recover naturally while you're staying as strong as possible and not just resting on the couch. But in some cases, that's not the entire picture. Sometimes we do need to look at other things like making sure we are improving neuromuscular coordination in certain body parts and certain joints. We need to look at mobility and making sure that it's full and restored across certain joints. We're really honing in on specific tissues or muscles and making sure they're built up the right way, especially if you've had a major injury in the past. But no matter what, activity modification is where you start. There is a baseline for everybody, no matter where you're coming from. You can use this list to find exercises that you can tolerate and that you can progressively overload and get stronger over time. And if you can start doing that, no matter where you're coming from, no matter how long that pain's been going on, you can get back to training. And if you're just stuck and you're struggling on how to apply this to yourself, that's where a little bit of individual personalized guidance comes into play. I offer free consults to help you apply this exact framework to your training history, your goals, and your injuries. The details for that are below. But if this video helped you in any way, please like, comment, and subscribe. Thank you.